Hello guys, 1st of December is World AIDS Day. Part of Cardiff University's Sexual Health Awareness Group's campaign is to highlight awareness of HIV. I hope you enjoy this short video about HIV.
Human immunodeficiency virus is the retrovirus that causes AIDS. It can be transmitted through blood, sexual contact, and even from mother to baby. HIV is not transmitted through saliva.
So what does the virus do? Well, over the course of time, the HIV virus will weaken the immune system. It'll invade and compromise the white blood cells that keep you healthy. And it'll make you susceptible to a variety of different infections that the body normally fights off easily. It'll also make you susceptible to a few different cancers. Okay, so this is a bit gory, but medically, what does the virus do? Well, after infection, about 2 to 6 weeks usually, the body will go through a period known as seroconversion. At least 80% of people will encounter this. It'll be a short, flu-like period of time, which will be easily shrugged off as being tired or run down. One of the major problems with HIV is that after this point in time, it's largely asymptomatic until you're very seriously compromised by it.
The groups most at risk of contracting HIV vary geographically. In the UK, it is gay men and recent migrants from sub-Saharan Africa and their respective partners. In the UK, the most common form of transmission is through unprotected sex with an infected individual. There has also been a recent epidemic in injection drug users through the swapping of dirty needles. AIDS is the final stage of HIV, when the body can no longer fight off common, but now deadly infections.
However you look at it, HIV is disproportionately more common amongst men who have sex with men. It's recommended that the annual HIV test be made available to all men who have sex with men, with regular testing being made available to those at higher risk due to multiple partners and unsafe sexual practices. In 2011, in the UK, 96,000 people were living with the HIV virus, of whom a quarter were unaware of their infection. Of that figure, 42,000 were gay men.
It is current routine NHS policy to test all pregnant women and patients at sexual health gov clinics, and it is relatively easy to diagnose an HIV infection. There are various blood tests available, some of which take as little as 20 minutes, so you could have your diagnosis in a single visit to a clinic. However, it can take several weeks after infection for the virus to become evident in testing. So, after your initial test, you will be advised to have another one a few weeks later as well.
So in terms of treatment, there's good news and there's also bad news. The good news is that the antiretroviral drugs available in today's modern medicine are very effective at making it possible for someone to lead a normal life with the virus whilst undergoing treatment. The bad news, however, is that these treatment regimes may consist of multiple drugs, which then will lead on to multiple side effects. Another point to make is that if a patient misses one of their treatment courses, the virus may become resistant to the treatment. Therefore, they may need to switch the drugs that they're on, which may lead to them being on more toxic drugs.
In terms of combating the virus, early diagnosis is vital. However, it goes without saying that the most effective way of dealing with the virus is to avoid it. This could be achieved through abstinence or the use of condoms. Critically, when you suspect that you have been exposed to the virus, you would be advised to immediately attend an A&E department and request an emergency anti-HIV medication, known as PEPs, post-exposure prophylaxis, which can be effective for up to 3 days after exposure.
A stigma was principally formed around the virus because of its association with sex. For a very long time, ignorance perpetuated the myth that HIV and AIDS were diseases which solely affected gay men and drug users. This was at a time when there was a much greater degree of prejudice towards homosexuality, so HIV has sometimes been referred to as gay plague.
Many HIV sufferers over time have experienced discrimination, especially in areas such as healthcare, housing, and domestic arrangements. This has led to HIV being described as more than just a medical condition, but as a societal disorder. Under the Equality Act 2010, HIV/AIDS is a disability. This protects sufferers, meaning that they cannot be discriminated against in areas such as education, employment and the provision of goods and services, including the NHS. However, there is still evidence of children in schools being discriminated against.
It's important to remember that a diagnosis with HIV is no longer the death sentence it once was. Patients who are diagnosed early, take their medicine and attend their healthcare appointments can do very well. There are certainly many examples of people in the UK currently living very good lives with HIV.
If you want to understand how serious HIV and AIDS are, all you need to do is look at the statistics. Every 10 seconds, someone in the world dies from AIDS. Approximately 34.4 million people are living with HIV around the world. Every 6.5 seconds, someone new worldwide becomes HIV positive.
December the 1st is World AIDS Day. In support of this, Shag will be running various events to try and raise as much awareness as we can, as well as much money as we can for the Terence Higgins Trust. The Terence Higgins Trust is a charity which works in the fight against HIV. They are just one of the many worthy causes who we support. If you want to get involved with any of our activities, check out our social media pages for more detail. Be sure to use our hashtag #SeeYouShag.